Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, as COVID-19 cases in the country are seen to peak this month, dengue infections are also on the rise. President Bongbong Marcos is open to making face masks optional only if the massive booster rollout becomes a success. And daunting challenges await a new health chief that the government still has to choose. Health Undersecretary Maria Rosario Vergeire joins us live. New COVID-19 cases in the country reached the 10,000 mark. As experts warn of an uptick in a few weeks, the figure translates to over 1,400 infections daily, 39% higher than the previous week. Dengue infections have also been increasing. The nationwide tally climbed to over 64,700 from January to June 25th. This is a 90% increase in cases reported during the same period last year. Also, a health expert urges the DOH to review the use of Dengvaxia due to rising dengue cases. Let's go straight to the source of the story. We have Health Undersecretary Maria Rosario Vergeire. Usec Vergeire, welcome back to the source, and thank you so much for your time.
Yes, good morning, ma'am, and good morning to all of you.
Let's begin with the COVID cases. 1,660 cases were reported Monday. That's lower than over 2,000 cases recorded last Sunday. Are we still expecting an increase in numbers? Should we expect cases reaching 2,000 and above?
Well, based on our projections, ma'am, we had these updated projections wherein if minimum public health standards would continue to be reduced at compliance to this by as much as 25%, and also if mobility patterns would still be maintained at this level, and waning immunity of the population brought about by the low uptake of boosters, we're going to see this number of cases but towards the end of this month. So yes, it might still increase until the end of the month. And what we are trying to flag to the public would be, if we do not uptake our boosters, the wall of immunity is really going down. We are going to see, based on our projections, increase in the number of cases towards the end of August and start of September.
The end of August till the start of September, would you call that the peak of cases?
I'm saying that towards the end of August and start of September, we might be seeing increase in hospitalizations. As to the increase in the number of cases, the updated projections would state that it might be the peak would be by the end of this July. But nothing is certain. These are just projections. There are a lot of things that can contribute to us not reaching this, or us really reaching that as early as maybe third week of July.
Yeah, but if you talk about peak of cases, what numbers are you looking at?
Well, based on the projections, it is as low as 1,800 cases nationally to as high as 11,000 cases nationally.
Oh, that's a lot, 11,000. But of course, there are a lot of factors here. You talked about a number of them: waning immunity, Usec, also health protocols not being followed, strictly followed. And in what you're seeing, with what you're seeing at the moment, are these restrictions, yung pong health protocols, waning immunity, is that causing a concern because of the mobility of people?
Well, the mobility is expected because we have opened up our sectors already. What we need to just ensure would be that people comply with the masking mandate, and also that people comply with our vaccination strategies, like improving our booster doses.
Right. But let's talk about first the 9.7 positivity rate. This is still, of course, nationwide at 9.7% positivity rate. In NCR, it's over 10%. The recommendation, of course, of the World Health Organization is a threshold of 5%. Knowing the numbers that you're seeing right now, is this worrisome?
Oh, well, one of the things that we'd like to always explain to the public would be that the positivity rate is just one of the metrics that we use to analyze our situation. We cannot base it solely on the positivity rate because it is affected by a lot of factors. Like, for example, the number of tests being done. And we all know right now that here in the country, we are also using the rapid antigen test, wherein it is not part of the official reporting or reported cases in the country. So what we
Yeah,
do is we correlate this with the other metrics that we have, like the number of those being hospitalized, the number of those severe and critical. So at this point, at this level of 9.3, yes, it is worrisome because the positivity rate is increasing and it translates to increasing number of positive cases. But we have to understand also that infections are expected because the virus is here and it is here to stay. The virus is mutating. As long as our healthcare utilization is maintained at that low level and our severe and critical cases at that minimum level, and I guess people can go back to this kind of situation wherein we can go to work and all, just so that we are protected by using our mask and by having our booster shots.
and hospitalization rate is still relatively low. I believe in NCR, we're still at low risk, right? But in other areas, such as Bohol, I believe it's at moderate risk at 63% hospital care utilization. And there are other areas as well that have a higher hospital care utilization rate, such as Batangas.
Yes, ma'am. No, so that is part of our close monitoring. Though our national figures and even in NCR, the aggregate numbers would tell us that we are less than 50%. So this is still low risk. But there are specific areas in the country, like what you have mentioned, Bohol, Batangas, and the others, who are having this increase in the number of admissions for COVID-19. But what we can observe would be primarily, number one, these are COVID wards that are being used. No, it's not the ICUs that are being filled up. These COVID wards, if you try to look, most of them are mild and asymptomatic when we tried analyzing our data. Second, some of the hospitals, the reason for their increase in admissions and also the reason for the increase in the percentage of utilization would be because they have reduced the number of their COVID beds. So these are the analysis that we have done. So far, what we have found based on our data would be there are still less severe and critical cases, and there is still this less utilization of our ICU beds.
Yeah. So unlike what the kind of emergency protocol that hospitals have, once there is an increase, nadadagdagan naman po yung bed space for COVID infections. And you're saying right now, we're still at that minimum bed space for hospitals regarding COVID infections?
Yes, ma'am. No, so actually, yesterday we had a meeting with our hospitals already. We started off with the National Capital Region, meeting both the public and the private hospitals, reminding them of our strategies when there are increasing cases. They need to prepare already, although we are not seeing, as I've said, the utilization of our hospitals being put into that maximum compared to the previous situations we've had. But still, we want them to prepare. And one of our strategies is the accordion principle, wherein if there are increasing number of cases, we need to expand the number of beds that we have in the hospital so that we can accommodate patients. Another thing that we have discussed with them would be our patient navigation and referral, so that it's going to be very organized across the different areas of the country, and that there would be no delays for our patients to be admitted in our hospitals.
So there was one thing also very important you said, and we've talked about this a number of times. When we talk about the number of infections, hindi ho kasi nasasama yung mga nag-antigen, and a number of people really just do antigen tests, especially at home, and then therefore, what they do is they isolate from the time of infection to the protocol of about 7 days. So the numbers that we're seeing right now, would you call this not really giving us the clear picture of the number of infections? In other words, would this be an underestimation of the number of daily cases that we are seeing?
Yes, in a way, we can say that, no, and that is a recognized fact, and we had been explaining this for some time already. That we are not capturing and we are not reporting into our official number of cases these antigen tests that are being done. We are receiving reports from our local governments and our hospitals with these antigen tests that are being used, but they are incomplete. And also, it needs further validation because not all who uses antigen uses it appropriately. Many of these reports would include those who had been screened even though they are asymptomatic. They use it for screening, for entering into work or entering into places. So these are not appropriate and we cannot report that as part of our official number of cases. We have a ballpark figure, the percentage of how much positive cases are being reported to us based from these reports that we receive. And that is what we use internally so that we are guided also. So this is about 20% from all of these antigen tests that we get. It's more than 100,000 already since January. And this is part of our analysis when we do our trending of cases.
Let me just say this, Usec, no, apologies because there are some periods that I don't really hear you well. I don't know if it's my connection or yours, but you're saying that you are getting reports of antigen tests since January to today. What I heard was you have been receiving about 100,000 antigen tests. And would that mean that 100,000, what is the positivity rate of those antigen tests?
It's about almost 15% of this. But as I've said, we still validate. We still need to verify if the procedure was appropriate, no, if they have used it in this appropriate manner. Because if you use it in an inappropriate manner, we are going to get false positive results. That's why we still need to verify. That's why up until now, we cannot really include this no immediately as part of our reported cases because of this new ones.
The process by which the antigen tests were conducted could be questionable, I guess. That's what you're saying, of course. What about the alert levels? Should government consider possibly raising the alert levels?
Based from our last discussions with our experts and also presented to the last IATF meeting with the previous administration, we already have revised our metric so that it can be more appropriate based on this current situation that we have. So what we want to emphasize right now and what would be most important for all of us right now, including government, would be the number of severe and critical and the number of those getting admitted in our hospitals. So we have revised our alert level metrics that if we have our average daily attack rate, which is the number of cases that affects a population in a given time, if we have it at high risk, but our healthcare utilization is still at low risk, we are not going to be escalated to a higher level of this alert level system. So that ensures, and that gives confidence that even though, and that is part of the direction in the current situation, that we know that we expect these infections, but as long as we can keep our severe and critical at that minimum level and hospital admissions at that minimum, and then we can therefore continue on with our regular day-to-day lives.
And how would you characterize the severe and critical cases now? Because we talked about healthcare utilization. For the most part, we're still at low risk, except for some areas such as Bohol, for example, at over 60%, that's at moderate risk. But you already described that earlier, that that could just really be also the infections or patients in the wards that may have come in for mild or moderate cases. In terms of severe and critical, how are the cases so far?
Actually, for the severe and critical, ma'am, it's plateauing, no? So we had been seeing it's decreasing pa. So we have a total of around almost 600 severe and critical cases all over the country. If you compare that with the previous situations that we had like that of Delta, it's really, really low right now. And if you try to look at it also from the previous weeks, comparing that, we are not having that increase in the number of severe and critical. It is maintained at that level only.
Okay. Community transmission, meron na ho ba?
We cannot say at this point, no, because we need to have enough evidence for us to declare officially that there is community transmission in the country. We need enough sequencing results to say that this specific subvariant is causing community transmission. But what we can say would be there is continuing transmission of the disease, and there is continuing transmission of these subvariants in the country.
And when you talk about subvariants, is the more dominant subvariant now the BA.5? Is that the one causing the spread?
Well, based on our sequencing results and try to analyze that, we are seeing more and more of this BA.5. At the outset, we initially detected BA.2.12.1, which we have seen to have increase in the number of these subvariants in the previous months. But right now, what we are seeing would be that based from the latest sequencing results that we've had, it's more of the BA.5 that we are seeing right now in the different areas of the country.
Okay, we need to talk about the booster vaccines and of course, dengue cases also on the rise. We will be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, Health Undersecretary Maria Rosario Vergeire. Usec, let's talk about booster shots. Boosted individuals now at about 15 million out of the 71 million fully vaccinated. I know government has been trying to encourage the public to get boosted, but what else can you tell us? What else can you tell the public so that they can get encouraged or to start getting their boosters?
Yes. No? So first, I just like to clarify, ma'am, that the eligible population for boosters would not be 71 million because this is a moving number based from the last or the time that you had your second dose. It's 3 months after that. So right now, our eligible population after cleaning our data would be around 49 million. So 15.3 million for our coverage. So we just like to inform our public that our immunity is waning. When the Omicron subvariants came in the country, it has affected the immunity that has been given by our first and second doses. And this is based on evidence and based from our experts' recommendations that all of those eligible in the country that would be 12 years old and up should receive their boosters to up their immunity again, that it be adequate against severe and critical infections. Based on studies, we have seen that around 80 to 85% improvement in your immunity, meaning you will get this kind of protection once you receive your boosters. So experts are saying also, and based from our updated projections, that if we continue on to have this kind of level of booster uptake, we might be seeing increase in the number of hospitalizations towards the end of August or early September. And this is not what we want for our country, which is really moving towards endemicity of it.
So that's why you came up with a possible increase in hospitalization end of August or September because of the immunity of the vaccine will begin to decrease. That's what you were referring to a while ago. So please talk to us now about, doon po sa mga nagtatanong, kailan ho ba nag-uumpisang mag-wane yung immunity ng bakuna? In other words, kailan ho ba bumababa yung ating immunity after our second dose?
Yes, actually, dun po sa mga pag-aaral no na pag-aralan natin based on evidence at saka po yun pong mga experiences from other countries, ang atin pong immunity from this would not be the same as po with other individuals. Iba-iba po tayo. So ang naging ebidensya po talaga, yung minimum po na buwan na pwede natin ibigay yung ating first booster shot would be 3 months after your second dose. So halimbawa po, nagkaroon kayo ng second dose nyo ng primary series noong Disyembre, eligible na po kayo na magkaroon nitong booster by March of this year. Ngayon, kung hindi niyo po yan tatanggapin, meron pong sinasabi sa mga pag-aaral that within 3 to 6 months, because of these variants, your immunity has gone down already, and you might be vulnerable again to severe and critical infections.
Right. That's why also out of the 71 million fully vaccinated, as you mentioned a while ago, you're cleaning the data because hindi po lahat ng 71 million eligible. So again, let's clear that up. After 3 months, pwede na po silang magpa-booster para po lumakas ulit ang immunity regarding this. But what about calls or proposals to make boosters mandatory? Personally for you, Undersecretary Vergeire, would you support such a move? I know that Dr. Salante, when asked, said he supports this. What about you?
Well, it's quite difficult to answer that because unang-una, kailangan natin basihan. We need basis here in the country if we are going to go into that direction. There is no law in the country specifically for COVID-19 na situation that would support that it becomes mandatory because in all of the laws that we have enacted for COVID-19, it is really voluntary. What we need to do right now is really to use our policy instruments wherein we can do our incentivizing and disincentivizing and also doing our nudges like more advocacies, doing settings approach where we can expand our vaccinations in different settings like in the markets, in our schools, in our churches, and the other places, and of course, still a whole of government approach.
Okay, and just to follow up on this also has been talked about for a while. And I know during a meeting with President Bongbong Marcos, this was discussed. Yung redefining po yung meaning ng fully vaccinated, which means your primary dose, first and second dose, kung dalawa po yun, plus yung booster. Is it time to redefine what fully vaccinated means?
Well, this is part of the discussions, and this is part of the recommendations of the Department of Health. But of course, we wait for the office of the president. Our president, if he's going to really support this and decide on this, that he approves of this. We need to consult also our stakeholders regarding this matter. But if you will remember, this fully vaccinated definition in last year, when boosters were not yet here, we used this already to incentivize and disincentivize our population. So that is really the direction. If we can have that, we don't need to make our vaccines mandatory, but we will use it as part of our incentives and our disincentives for the public so that they can get more encouragement.
Again, we need to take a very short break. This is The Source on CNN Philippines. Please stay tuned. Welcome back. Let's talk about the dengue cases. Dengue cases from January to June 25 of this year is at 65,000. That's a 90% increase from the same period last year. Undersecretary Vergeire, you already said this is alarming. But why the steep rise? What happened?
Well, if you compare our situation now compared to 2020 and 2021, we had restrictions in the previous 2 years. And therefore, the mobility was really low. And the interaction between and among the population is also lesser. So if you talk about these infectious diseases, the more that people interact, the more that the transmission will happen. And that is really part of the contributing factors why we are seeing more cases of this specific disease right now, dengue. But also, we have to take into consideration that this is the rainy season. And this is really that time of the year where this number of cases are expected to increase. So what we just need to do would be to do the preventive measures because this disease is caused by a mosquito. The source of the infection is a mosquito. And therefore, we have to clean our surroundings so that we can be able to stop and destroy the breeding sites of these mosquitoes so that we can prevent further infections.
Would you already consider this an outbreak?
We have already breached the epidemic threshold in some of the areas of the country. We are having clustering of infections. But as to outbreak, we are still trying to analyze further because these are pockets of cases in specific regions and not really forming one aggregate area or big area that has all of these cases. So we are further analyzing and further studying this.
I understand what you're saying, that this is a bit of, and it's not right, or it's not really proper to compare what happened this year compared to, let's say, 2021 and 2020 because of the pandemic. But would you have a number in 2019 when, prior to the pandemic, how does this number compare to 2019 where, we did not experience the pandemic just yet?
Well, I do not have the exact numbers right now, ma'am, but based
That's
from
fine.
my understanding and my recall, the number of cases would be higher, no, in 2019 compared to 2020 and 2021. But comparing the 2019 with our numbers right now, it's a little bit higher for this time period compared to the 2019 numbers.
Okay, just one last question. What are your thoughts on this? Should the dengue vaccine, Dengvaxia, again be studied and possibly be reconsidered?
Well, it can always be studied further. But right now, this vaccine doesn't have any CPR in the country. It has been canceled, no, in that year that the cases were reported. So we just need to further study if really there are specific and completed evidence already at this point, completed trials at this point, that this vaccine can very well protect our population. Our government would always be open to technology, but it has to be at that stage where we can always say that there is evidence, completed evidence, and there are complete studies already to show that it's going to protect our population.
Health Undersecretary Maria Rosario Vergeire, thank you so much for your time.
Maraming salamat po.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.